Hi everybody, Dr. Vito here. Today I want to speak with you about the importance of balance, how that relates to posture and your spine and just your overall health, particularly if you are in the over 60 category. Okay? Here's a startling statistic that I learned a number of years ago. I was doing some continuing education and the speaker said that statistically, if you are over the age of 75, you have a higher mortality rate, so you will die sooner if you have a fall as compared to if you would have received a cancer diagnosis. So you're better off getting cancer than you are if you fall over the age of 75, okay? And it's not much better if you're around the age of 70. So this is the importance of proper balance, is because we want fall prevention. We want people to be strong and not falling over, because once you fall, you're limited in your mobility. When your movement goes down, a lot of other problems just cascade and snowball from there. So we want to stay upright, okay? So posture, balance. Now when it comes to balance and its relationship to posture, there's really two angles that you look at, right? So from this side, if you have a scoliosis, bend in your spine, or something like this, your risk for falling isn't going to be very high, right? Our bodies are very good at compensating. So oftentimes if someone has a curve this way in their lower back, maybe this left hip is lower than the right side, we'll see it compensate up into the middle back or the neck so the body can balance itself out. However, it's when we look at the side view here that we see the bigger concerns, okay? The biggest contributor to people losing their balance and falling is having what they call a positive sagittal balance. This is a sagittal plane. When you have positive sagittal balance, it means your center of gravity is in front of your feet. So this person here that's all hunched forward because they've been looking at a computer for 40 hours a week over a span of 20 years, they're all craned forward. Their positive sagittal balance is going to increase their chance for them falling forward. How can we strengthen the body to prevent this? We gotta work on balance or posture. We gotta get the spine upright. This is really important and helpful even if you're over the age of 65, 70, 75. My oldest patient was 98 years old, very sweet woman. She was very osteoporotic, very fragile. However, her goal was to not rely on her walker so much. She wanted to be able to stand on her own 2 feet, and I was able to help her, and very safely as well. So positive sagittal balance is what we want to avoid. We want to strengthen our posture. So the way to do that is, first and foremost, get your spine checked, get your spine adjusted so we can help get better movement into those joints. The other thing I like to do is strengthen the ankles and your lower half, right? If your ankles and your sense of balance is better, then your risk for falling is better. So what I encourage most or pretty much all of my patients over the age of 75 is, on a regular basis, stand on one foot for 30 seconds, okay? This is called the stork. You bring the knee up nice and high, and the goal here is that you would be able to stand on one foot for 30 seconds consecutively. This should not be difficult. However, you'd be surprised maybe if you try it that it's not so easy for you, and that should be a pretty big red flag. So you would obviously want to do this on both sides. Took a stumble there. There we go, okay? I encourage everybody to make sure, if you're worried, that you have something nearby that you can put a hand on in case you fall, a countertop or a wall. But this is a very helpful exercise to do on a regular basis if you're in that risk category. So strengthen your posture, stand upright, get adjusted, and work on your balance by doing the stork a little bit every single day, and you will benefit greatly, and your decreased mortality will allow you to add years to your life and life to your years. Thanks a lot.